Okay, today we will continue to take up visual diagnosis, pale nose, and yellow nose. The nose was called in ancient China the bright hole, Mingtang, of the face. It is place where the clear yang converges. The nose is the convergence of clear yang for two reasons. First, because it takes in air, which is yang in nature. And second, because the governing vessel of all yang energies, governor of all yang energies, flows through the nose in pathological condition in which clear yang does not ascend to the nose. Turbid yin accumulates there, causing ailments such as chronic sinusitis or rhinitis. Another reason the nose was called the bright hole in ancient times is related to Chinese face reading, according to which the nose represents the years from 41 to 49 in a person's life, because these were considered the times when people established their career on a firm basis. The nose was compared to a hall, the most important room in a Chinese house in ancient times. The nose is influenced primarily by lung channel because the lung opens into the nose and controls the sense of smell. Chapter 37 of the spiritual axis says, the nose is the sense organ of the lungs, and the chapter 17 says, the lung qi penetrates the nose. When the nose is harmonized, it can smell. Chapter 4 of the simple question says, the west corresponds to the white color, and it is related to the lungs, which opens into the nose. The Song Dynasty, Dr. Chen Wuji said, the nose is the orifice of the lungs through which we breathe and smell. Yang qi ascends and yin qi descends, and the nose, so that it is the passage of clear qi, does not actually reach the nose. It therefore influence it through the large intestine channel. Okay, the pathways of the channel flowing through or around the nose are as follows. As you can see at the right side, the picture with the lines and the broken lines. Okay, both the main and the muscle channels of the large intestine channel flow to the bottom of nose and influence the sense of smell. Okay, the stomach channel connects with the nose. Okay, the bladder muscle channel reaches the bridge of the nose. You can see. Okay, then the governing vessel flows downwards through the nose. Okay, that's it. Through their channel, the large intestine and the governing vessel influence the sense of smell and cause symptoms such as sneezing in allergic rhinitis or nasal discharge in sinusitis. Channels influencing the nose. Okay, lung main channel, although it does not go to the nose. Okay, governing vessel, large intestine main and muscle channels, stomach main channel, and bladder muscle channel. Apart from the relationship between the nose and the channels, in these channels, the shape and color of the nose have particular diagnostic significance in facial diagnosis. In fact, The pathological colors of the nose may reflect pathology of other organs such as liver and spleen. Chapter 37 of the spiritual axis says, bright whole nose can be five pathological colors reflecting the chi of the five yin organs. Different parts of the nose are related to different organs. Okay, as you can see in this picture, this is the organ reflected on the nose. Okay, lungs, heart, gallbladder. Lungs, heart, gallbladder. Okay, the liver, center, the stomach. Okay, and the tip is the spleen. Okay, chapter 19 of the spiritual axis says, the bone of the bright hole bridge of the nose should be high, even and straight. The state of five yin organs can be determined from the center of the nose, while the state of the six yang organs from the side. Okay, pale nose. A pale nose may indicate stomach and spleen qi deficiency with empty cold. In such cases, the pallor is primarily at the tip. Blood deficiency, usually of the liver, may cause the bridge of the nose to become pale. Among the full conditions, phlegm-fluids may cause the tip of the nose to become pale and swollen. A white and very dry nose indicates severe lung qi deficiency. Okay, pale nose, pale tip, stomach and spleen qi deficiency with empty, cold. Okay, pale bridge, this is a liver blood deficiency. Pale and swollen tip, this is phlegm fluid. Pale and dry, that is lung qi deficiency. Okay, letter A, the stomach and spleen yang deficiency with empty cold. Okay, pale tip of the nose, discomfort or dull pain in the epigastrium that is better after eating and better with pressure or massage. No appetite, preference for warm drinks and food, vomiting or clear fluids, no thirst, cold and weak limbs, tiredness, pale complexion, loose stools, feeling cold, cold limbs, pale and wet tongue. And the pulse is deep, weak, and slow. Letter B, liver blood deficiency. Pale bridge of the nose, dull, pale face, dizziness, blurred vision, floaters, numbness or tingling of limbs, scanty menstruation, pale tongue, and the pulse is choppy or fine. Okay? Letter C. Phlegm fluids. Pale and swollen tip of the nose. Swollen face, greasy skin, abdominal fullness, and distension. Nausea, vomiting, or watery fluid. Dry mouth, without desire to drink. Shortness of breath, dizziness, a feeling of oppression of the chest, swelling of the limbs, expectoration of thin, watery sputum, inability to lie down, swollen tongue with sticky coating, deep, wiry, or deep, slippery pulse. Okay? Yellow nose. The yellowness ranges from the fresh, bright yellow to a dull yellow. If the yellowness is caused by damp heat, usually in the spleen, it will be bright if heat predominates and dull if dampness predominates. Okay, that is the difference. A chronic spleen-chi deficiency with retention of dampness is a common cause of dull yellow color, usually at the tip of the nose. Spleen-chi deficiency with phlegm may cause the nose to become yellow and dry. Liver blood stasis may cause a dull, dark yellow on the bridge of the nose. Spleen heat causes the tip of the nose to become bright yellow and dry. Finally, phlegm fluids may cause the tip of the nose to become yellow and swollen. Okay, this is a damp heat in the spleen with predominance of heat. Dull yellow, that is a damp heat in the spleen with predominance of dampness. Yellow and dry, that is phlegm with spleen-chi deficiency. Dull, dark yellow, that is liver blood stasis. Bright yellow and dry tip, that is spleen heat. And last, yellow and swollen tip, that is a phlegm fluid. Okay? In treatment note, for dampness in the nose, liver 4, uh, do 23, REN 12, and stomach 43 for acupuncture points. Okay. Damp heat in the spleen, letter A. Bright yellow nose if heat predominates, or dull yellow nose if dampness predominates. Greasy skin, fullness of the epigastrium, epigastric or abdominal pain, sticky taste, thirst with no desire to drink, poor appetite, a feeling of heaviness of the body, thirst, nausea, vomiting, loose stools with offensive odor, a feeling of heat, scanty dark urine, headache with a feeling of giddiness of the head, dull yellow complexion, bitter taste, red tongue with sticky yellow coating, and the pulse is slippery rapid. Okay? Chronic spleen-chi deficiency with retention of dampness. Dull yellow tip of the nose, dull pale face or appetite, slight abdominal distension after eating, tiredness, lassitude, pale or sallow complexion, weakness of the limbs, loose stools, slight depression, tendency to obesity, abdominal fullness, a feeling of heaviness, a sticky taste, poor digestion, undigested food, and the stools. Nausea, dull frontal headache, excessive vaginal discharge, pale tongue with sticky coating, and the pulse is soggy. Okay, next. Letter C, liver blood stasis. Dull, dark yellow bridge of the nose, dark complexion, hypochondrial pain, abdominal pain, painful periods, menstrual blood, dark and clotted, mass in the abdomen, purple nails and lips, purple tongue, and the pulse is wiry and clear. Liver blood is always with pain. Okay? Letter D, spleen heat. Okay, bright yellow and dry tip of the nose, burning epigastric and or abdominal pain, excessive hunger, red tip of the nose, dry lips, mouth ulcers, thirst, dry stools, a feeling of heat, scanty dark urine, yellow complexion, red tongue with dry yellow coating, and the pulse is overflowing rapid. Okay? Next. Letter E, phlegm fluids. Okay, the phlegm fluids, dull yellow and swollen tip of the nose, abdominal fullness and distension, nausea, vomiting, or watery fluid, dry mouth without desire to drink, shortness of breath, dizziness, a feeling of oppression of chest, swelling of the limbs, expectoration of thin, watery sputum, inability to lie down, swollen tongue with sticky coating, and the pulse is deep, wiry, or deep, slippery. Right. Next. Okay. Thank you for your attention. Good day.